Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. First of all, let me introduce myself. My name is Khamila Gayatri Anjani. I'm in residency program of Maxillofacial Radiology in Universitas Pajajaran. Today, I would like to present about my case about unilateral temporomanibular joint displacement without reduction, a case founding in CBCT. So, an 18-year-old female reported to the radiology department of Universitas Pajajaran Dental Hospital for an examination TMG open and closed mouth using CBCT with the chief complaint of unilateral pain and locking in the sinistra TMG. On extraoral examination revealed that the patient had limited opening mouth. Intraoral examination revealed a crowding of 34, 35, and 36. So on radiographic examination in closed mouth position, as we can see, as sinistra TMG, the head of condyle is erosion or it's thinning of cortical bone, while dextra TMG, the shape of condyle is erosion and head of condyle resembling a bird beak. It has a pointed part at the head of condyle, so we call it as bird beak. In Sagittal view, we can see the sinistra TMG had the head of condyle as resembling a bird beak and dextral TMG is erosion. So this is the result of joint space measurement from sagittal and coronal view in closed mouth position, and we compare with the normal joint space measurement by Ikeda and Kawamura. As we can see in sagittal section, for anterior joint space, both dextra and sinistra has the higher value than the normal, while the superior and posterior has the lower value than the normal. And then for the coronal section, as we can see, medial joint space for sinistra, it has higher value than the normal, while the others has the lower value than normal. So on radiographic examination from axial view in closed mouth position, we can see that the position of this TMG looks asymmetrical, where in the image on the left, we can see when we focus on the left TMG, we can see the image of the condyle head from the right TMG as well. When we look or check the position of the right condyle, then we can see the position of the left condyle. It can be believed that there is an asymmetry of the position of the condyle. So, based on clinical and also radiographic examination, here we diagnose this case as displacement without reduction. The MG is formed by the condyle of the mandible and also the temporal bone, namely the mandibular fossa. In the center of this bone is the articular disc, where it is a fibrous connective tissue devoid of nerves and also blood vessels, and is the posterior part of the connective tissue. In the closed mouth position, the posterior disc is located at 12 o'clock to the head of the condyle. So this is the difference in the position of mandibular movement when opening and closing the mouth under normal condition, this displacement with reduction, and this displacement without reduction. We can see that during the closed position in normal condition, the position of the posterior disc is right at the head of the condyle. Then when it's open, the mouth, it will walk harmoniously so that the condyle can pass through the articular eminentia. Then, in the state of this displacement with reduction, we can see that in closed mouth position, the disc position is anterior to the head of condyle. Then, when it's open, it will return to normal. Whereas this displacement without reduction, when closed position, the disc position is anterior to the condyle and doesn't return when opening the mouth. The following is a table regarding the most common TMD diagnosis and their clinical features. How can we see that this displacement without reduction with limited opening is a non-painful condition with clinical finding in the form of limited mouth opening affecting function with maximum assist opening of less than 40 millimeters. The definition of this displacement is the movement or displace from its normal position in relation to the head of the mandibular condyle in open and closed mouth position. With the clinical feature is limitation in opening mouth, pain, and also facial asymmetry. The radiographic features, MRI is the standard method of evaluation of the MG, and this displacement is the commonest abnormality and includes anterior disc displacement. Radiographic modalities that can be used to see temporomandibular disorder based on abnormalities such as disc displacement with or without reduction. They can be used are MRI or USG because this is related to the position of the disc. They can be detected through the soft tissue modalities. So we can conclude from this case that this displacement in the TMG is a frequent case. This condition can cause the condyle to change its position in the fossa with alteration in joint space. CBCT analysis is one of the methods to assess the changes of condylar shapes and also position. That's all my presentation. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.